Welcome viewers to this program on primary prevention of heart disease and the role of Universal Healing Program, popularly known as UHP. We have with us today a panel of highly distinguished medical practitioners, all of them cardiologists, who will be sharing their thoughts on prevention of heart disease and other related issues. Now Dr. Kapadia talked about statin, so we would also like to have the views of the cardiac surgeon for statin, please.
I'm not sure I can add much more than what they've spoken, but we give statins even in patients who have had a transplant, for instance.
Okay.
We have a fair amount of transplanted hearts can also develop blocks, though the mechanism of coronary artery disease in a new heart which has been transplanted is different. It's in fact the commonest reason why transplanted hearts don't last forever. The median survival is around 15 years, is because of what we call coronary vasculopathy of the new heart, and there seems to be some kind of a chronic rejection. So the mechanism of those plaques is different from primary ischemic heart disease. But even in those situations, statins actually have a beneficial effect, apart from other immunosuppressive drugs. So statins are our friend. So we put patients that any patient I operate on for either bypass surgery or transplant would be on statins of some kind.
Yes. Dr. Manchanda, can you add to that, please?
I think they're extremely useful drug for the prevention of coronary artery. There's no question about it. For secondary prevention. Primary prevention, there is still a doubt. High risk cases should be given. And the dose should be high. As Dr. Kapadia said, after myocardial infarction, the dose has to be 80 milligram. We stop it after some time, but it should be continued. There are studies now to show 80 milligram is tolerated very well and all that thing. And only problem with the statins is new onset diabetes. So should not be given indiscriminately for primary prevention. About 10 to 20% of the patients develop new diabetes, which is of course outweighs the risk of benefit. The benefits are there. You see, we are producing a large number of diabetics in our country. We have a concern of that. So anybody who is taking statins, especially high dose, should be monitored for diabetes. That is the only, but the advantages are too much. I think this is one of the biggest advances in cardiology. Lipids, they have reduced the mortality significantly, more than any other intervention. As you asked him a question, I will just like to answer why the heart disease has decreased in many countries. They have tried to find out, is it angioplasty, is it bypass? They found that 70% of the reasons are lifestyle changes, just lifestyle, and the another 20% are drugs like statins, ACE inhibitors and so on. So some drugs have really decreased it, and lifestyle. Angioplasty, bypass have contributed less than 5%. Although they may look very, very good, they may relieve some pain of the patient, but in relieving death, they are not outweighing the risk, as even giving up smoking, for example, is much better than doing an angioplasty as far as the benefit of reducing heart disease is concerned.
But I will add something. If you, amongst other things which I think, as Dr. Manchanda said, the incidence is coming down, is
in Western countries, not in India.
Precisely, that. Is in fact, we discussed it in a break. If you look at the role of, say, the American Heart Association, those are dominant organizations, and their messages are taken seriously, whether it's limiting salt intake and controlling blood pressure, or mandatorily to publish in every the pamphlet of every food available in the supermarket the nutritional contents of that package. In most restaurants now, if you go, it gives you the caloric value and the in this country, that doesn't necessarily hold true.
But that necessarily may not affect the people.
But people are more aware of what they are eating.
Obesity is increasing in the Western, you see. The mind control is important.
No,
this is very important.
For those who want it, that information is available.
It is available, but in spite of that, the obesity is increasing in America, in the European countries. They know it's bad, still they take it. And this is where I think meditation
mind control
is important, because they know it's bad, still they're doing it. As I said, my patients know exercise is good, still they don't do it. Why don't they do it? Because the mind makes some excuse. Today you can have a burger, not tomorrow. The tomorrow never comes. But you see, in spite of all that, the obesity is increasing in the United States. This is going to be the biggest problem. 50% of the Americans are going to be obese, and Europeans. At present, 33% are. And they don't know how to tackle it. In spite of all those warning, nothing is happening. So I think the approach that we have at least experienced, myself and Dr. Kapadia, is that we must try to teach them meditation or a universal healing technique so that their mind is under control.
Yeah. Coming back to food, Dr. Balakrishnan, you pointed out about this, the nutritional values and all that. But, and again, this question I'm asking because of a lot of articles in the media and people comment. Any comments on processed food? Because there's a more processed food available in this country. Vis-a-vis, we are a society where we've been used to taking fresh foods, and then we started storing in the fridge. Today there's processed foods. So any comments from your side, please?
Clearly, fresh food is superior if you have access to it.
Okay.
But lifestyle changes being what they are, in big cities, often we have no other choice, or people think they have no other choice.
Okay.
I also have grave doubts about the Indian FDA equivalent of the certifying authorities, how reliable those safety of those processed foods is in terms of whatever it contains, either in terms of preservatives or the kind of infrastructure which is used during those preservations. And then the salt content of all kinds of processed foods is enormously high. In fact, tastier a food material is, more unhealthy it seems to me to be. And coming to salt, increasingly it's been recognized for a long time, not only in heart disease but in the incidence of renal failure, for instance. Sodium is considered one of the villains. To a large extent is also a matter of taste. If you for the next 15 days, if you cut down your salt intake by 50%, initially you'll struggle, but after that you'll find it difficult to eat in a restaurant. So it's an acquired taste. But awareness of the nutritional components to your health, at least to a large extent, that will make people think before they put anything to their mouth. I often use this as an example. When we buy a car, we often drive 10 kilometers to a petrol station which we think gives you unadulterated petrol. But we don't give that much thought to what we put into our mouths.
Okay. It's interesting.
Yes. You're right. Processed foods and the refined foods are the biggest culprit for the heart diseases. Report in British Medical Journal. We get these imported apples, etc., which are plucked 3 months earlier and they're kept in cold storage and artificially. The food value is zero. Antioxidants and fiber, etc., is very poor. So we should take fresh fruit
as far as possible,
as far as possible, seasonal, which was a part in our country.
Yes.
Now you can get throughout the year, which is not very good. Secondly, we should not take refined food. These are the two biggest culprits. Thirdly, as he said, fast foods in India are completely different. Even this big change, I was surprised. There is a suggestion that the use of fat they use, the salt they use is much, much higher. This will be never approved in the Western countries because the amount they use. So therefore, as he said, I think we must have the nutrient which should be written outside how much salt is there, and they are completely different, and that's why I think we are getting this disease much more.
I saw a TV program last week in the BBC about a major pizza chain in India. I don't want to wish to name it. Where instead of using cheese, they're using a substitute which contains fat and mayonnaise to make it taste like cheese. So, and when a BBC correspondent tried to interview them, they kind of shut it off. I saw a major program. So the Food and Drug Control authorities in this country
should be strict.
So the regulatory authorities should be more aware.
I wrote an article long back. Veggie burger is much worse than hamburger because the amount of fat, mayonnaise they use is much, and nobody bothers here. Because it's a veggie burger, it's vegetarian.
Veggie doesn't necessarily mean it's safer.
Veggie means it's not safer at all.
Yes.
Because the amount of mayonnaise.
Again, it's a question of perception. You think veggie may necessarily mean safe, but how it is served, what additional things are put in it, that's very important.
They deep fried 3 times, the potato inside, and then they put so much of mayonnaise, which is so much fat.
And other supplements. Yeah. Now, Dr. Kapadia, coming back to Universal Healing Program, how do you intend to take it further? Because you have brought it to this level more in Gujarat, Ahmedabad and Gujarat. But as we have discussed today, the key essential components of universal healing, and that too, like you said, the dietary control, the exercises, and the savas and meditation. How can we take this program a little ahead for more awareness in the country, sir?
Look, we are trying our best, and we have put whatever experience we have on the website universalhealing.org. Yes. One word, universalhealing.org. and we have got an application which is also free. We put a capital USP on a Play Store on that, and we can download all the things that we have been doing up till now. Then all our publications are also, all the publications are also can be downloaded free of cost. Everything is there. And now I'm very proud and happy to tell you that the program that we have been doing it for last 26 years have been approved so much that it has been called a Gandhian program, in the sense that it is a program which deals with the basic things in life, not only health, but in many respects it promotes universal brotherhood. So when you become one with the breath, I found that people lose their prejudices and all that, and they become more friendly, they lose their hostility. And as I said, one report, the recurrence of angioplasty in some people, the failure of it was related to hostility score in one of the papers. So the hostility and all that can be reduced over and about. Why I called it universal healing, as I said before.
Yeah.
It was started for coronary heart disease. Yeah. But then I found out as I doing that it is healing the whole individual, and therefore we call it universal healing. And now I'm convinced, forget about the name to it, but if people can practice for 10 minutes twice a day, the simple technique of how to relax the body and mind and become one with the breath, simple, turn the breath, then that will change, because I've got experience of large number of people in feedback and all that they can do it. And now the Gujarat Vidyapith, established by Mahatma Gandhi in 1920, is going to celebrate the 100th year now very soon. They put up a hall, Universal Healing Center Hall, and that they are going to promote the whole program from there, from that institute. So that will be, I think, give a great push, and it comes from there. Yeah. And we are trying to popularize it in many ways. But this label that it is Dr. Kapadia's program or Dr. Dinoni's program, no, that's not the issue. The program is of the whole humanity at the moment, as Larry Doshi says. Yeah. You must read all the references of Larry Doshi on this program. This program is of this doctor, that doctor, now every one of us, where the crying need of the hour is universal brotherhood. And as Rabindranath Tagore said, that I will not sacrifice nationality for humanity. You see, that extent he was concerned. He found Gandhi. He told him that I agree with you at the moment, all this struggle and all that, but this nationality, there is universality. There is no borders. Borders were not seen by that fellow who went up to the moon. He saw it is only one globe, and we fought the border. So many things are coming up now in every way. We are disturbing. So this program, I've been a student of literature only. I've never studied medicine. First 5 years of medical, I just wasted them. I never take up the thing for dissection. The other partner was dissecting. I was just watching it. So the whole literature I wanted to, but the literature came in the treatment of coronary heart disease, which I think is not only a physical problem, a coronary heart disease, but it is a very important spiritual, mental problem, coronary heart disease, apart from the physical. And the treatment of it also requires a very great aspect of understanding the patient, talking to him and explaining to him, and of course the armamentarium which we have got now. So Universal Healing Program, I wish that it becomes a regular practice for each person on this planet to practice for 10 minutes twice a day. But let it not be known as Dr. Kapadia's program.
Already I think the government is helping quite a lot. Our Prime Minister has made yoga almost popular all over the world.
All over the world.
And the yoga is exactly similar to what it is. It's not only a few asanas. It's not meditation. It's a complete holistic way in which the diet is important, in which stress management is important, and that's why it's becoming now compulsory in schools. In the United States, I am told, my friends have done research, they are going to make it compulsory. So there's a big help coming to him. Our Prime Minister has made more or less yoga now almost compulsory in schools and universities and at early level, and I think that's going to be a big boost. He has already shown the scientific. We have shown also some data, but from early childhood, if this yoga can be incorporated, which is similar to universal healing program, I think this will go a big way.
Thank you.
Now,
please.
I think also popularized amongst doctors, because there's evidence that the average life expectancy of a doctor is 10 years less than the controlled general population.
That's a startling revelation.
No,
sure,
fact,
it's true.
It's a fact.
We all died 10 years earlier.
Cardiologists have heart disease, you see. And it's glad that every hospital now is going to have a yoga.
See, Dr. Barkin, you are part of a Fortis group, and in India, there are so many now corporate hospitals coming up. And what in your views where the corporate hospital chains can help in prevention, not only of heart disease, but basically the preventive approach, rather than curing? Yes, it is healthcare is a business, that's very true. But also there is a kind of a social, corporate social responsibility of the healthcare sector to contribute in prevention.
They have a preventive medical checkup program in most hospitals, where unfortunately it functions more like a battery of tests and annual checkup.
Yes, I'm talking further than that, if we can.
So it has to be, I think, it has to extend beyond that to maybe classes on wellness.
Sure.
Dr. Manchanda and Dr. Kapadia talking about. And as I said, advice on sensible living.
Yes.
Now, these are idealistic aspirations. The moment you finish that and go back to the real life where dog is eating dog, you have to, you get back into the world. So, but I think that increasingly in workplaces, people have, at least in the corporate world, not in hospitals, where there is a gymnasium, for instance.
Yes.
Where there's a shower, there's a sauna, there's a meditation
lot of IT companies
zone.
do have this.
Yet, I never see that in a hospital.
Okay.
Paradoxically, the places where we heal in our country seem to have very little space for prevention or for wellness of people who work in those, because space is a premium. And unfortunately, unlike IT companies or other companies, which have the luxury of being located outside the city where the real estate costs are low, by the very nature of its business, hospitals tend to be in the heart of the city where patients find it easier to come. So the real estate values are crazy in this country.
Yes.
So they don't want to waste any available space on anything which even remotely resembles as amenities to the people who work there.
Okay.
Is it true or not?
Absolutely. Yeah, preventive checkup should be modified. We have modified in our hospital. We have a yoga teacher, we have a psychologist. Because I tell them health is not mere absence of disease. It's a state of physical, mental, and social and spiritual well-being. And that includes the universal program. Universal healing program. So this is exactly, I think, if they can slightly modify these, which are not difficult. I know many corporate hospitals which have a psychologist. Because a patient comes to me, he says, my tests are fine. I am fine. I say, you are not fine. Because my psychologist tells you get a lot of anger. So you are mentally not healthy. So I think that concept, if it can come in the corporate hospital, it will be very good. Many corporate hospitals have so-called well-being clinics also. Well-being is also incorporating. So that will be paying. I can tell them.
Sure.
In Gangaram Hospital, we have a yoga teacher who gives a class to all these people who come for preventive checkup.
So all this stuff, the doctors, the paramedics and everybody.
Yes, it's possible.
And thank you, doctors. And before we conclude, the last comments from Dr. Ramesh Kapadia, please.
I tell you, I've got a beautiful comment to make.
Please.
First time all these years, that I have been a resident of India and now traveling all the time to United States and all that. First time, a commissioner of health, joint commissioner of health, happened to be she approached me and she said that your program is so wonderful and we want to take it to every school in the class and all that.
Wonderful.
Now, I should say that when would I tell the government to do it? Because here, unfortunately, I don't want to comment on it, but in the United States I have seen that wherever there is merit, the authorities approach them.
Yes.
Here the merit, but first time I found the merit approached by the authority, and that has really encouraged me to work very hard in this respect, and I hope we will be successful. And I'm very thankful to these two doctors who came to sit with me for this discussion at a very, very short notice.
Yeah.
And therefore, I am most thankful to them.
Yeah. Thank you, Dr. Kapadia, Dr. Banchanda, and Dr. Balkrishnan. Viewers, I'd like to conclude that I feel this session has been a great take-home for all of us, for the patients. All these experts have clarified a lot of issues dealing with heart disease prevention, and also we talked about the common well-being of people today, and the preventive part, which is very important for the people of our country, and especially for the young people, because they comprise the majority population of our country. We are grateful to all the three panelists who shared their thoughts on this subject, not only for the treatment, curing, prevention, but also their views on what things can be done on the macro level. And we also wish Dr. Kapadia's Universal Healing Program spreads to more people and more states in India and more countries in the world for the well-being of all human beings. Thank you, viewers.